This bushfire season has really been a calendar of rapid-fire disasters. Just as we count the lives and property lost in one region, we have to brace for the next firestorm in another. It's not just impacted victims, I think it's having a profound effect on the mood of the nation. Thankfully, part of the government's Relief and Recovery Fund involved dedicating resources to deal with those who are suffering mental health problems as a result of the bushfires. To shed some light on this, psychiatrist Tanveer Ahmed has joined me in the studio this evening. Thank you very much for coming in.
Thanks for having me, Chris.
How do you logistically organise something like this? Do you just get a team of government psychologists and psychiatrists and send them into areas that have been decimated? Is it that raw and simple, or how would they work this?
Look, Chris, there's actually been a lot of work done on this. How do we deal with disasters? You know, they've looked at the tsunami, the Queensland floods were quite an interesting area where they studied a lot of this. And some of the mental health effects aren't what you think they are necessarily. For one, many of the initial mental health is actually very positive, because these type of events, we actually live in quite kind of, you know, sort of atomized, we're sort of all mixed up, we're doing our own thing, we're quite disconnected. These sort of events actually bring people together and bring a real sense of common purpose. And
all of a sudden you know people in your area you've never met before.
So suddenly people who've never talked to each other, suddenly you'll have a real, you know, they're like, we're going to do this, we're going to help out so-and-so.
It must be good to be able to say, OK, I've lost half my house, I've lost things, I'm grief-stricken, but I've now got a list or a plan ahead that I want to achieve over the next 3 months.
Well, I heard this fabulous interview on the radio today, just talking about a woman, how she felt so safe. It was like she was in the arms of the RFS and the Australian people, and I thought it was a beautiful sentiment. So initially, you'll often get a real sense of purpose. We're all coming together, we've got a common purpose in such a diverse society. This brings everyone together. So some aspects of this are actually positive for mental health. Now, in the longer term, the people who are actually on the front line get exposed to some life-threatening incidents. Some of them may well develop disorders, but the people who usually develop disorders are often the people who already have some pre-existing problem.
Oh, right.
So they're the people most vulnerable.
Because a lot of the firefighters were upset that after the fire had passed and they'd saved scores of homes, that 4 or 5 homes were homes that they couldn't save, and they were just distraught about it.
Oh, absolutely. That sense of loss. I mean, usually after these things, when people can't make any sense of what happened, or they can't impart any meaning, or when it's over, they feel adrift, like they're not getting any support. So this is why often with veterans, they're more likely to have PTSD, because they often come back from a time of intense kind of action at war, and they end up in somewhere nobody understands what happened to them. In terms of your questions about service, that is really important, because you look at the areas this happens, they're places already under-resourced from like a health point of view. You know, Australia's got a huge, stark difference between the services we get in urban areas versus some of these regional areas. So there's no question some of these groups will need, you don't necessarily need really high levels of expertise. Often you need practical support.
So maybe a clinic and someone in the field to work out who's doing it.
Absolutely. Right. You might need more GPs and being able to kind of transit. But at the end of the day, the biggest predictor of better mental health is good practical support.
Right, OK.
Right, so that's where... there was a period where, in my field, there was a view that we've got to send people in, debrief, you know, counsel them straight away. That was shown to be bollocks. It didn't actually help people. It's not what people want in the immediate arena, in the immediate aftermath.
OK, let's increase the net, because I have a feeling that people are a little bit dejected and depressed about the rapid-fire disasters that others have had to deal with. So I think it's sort of almost nationwide, and Bushfire Recovery Chief Andrew Colvin made that point today.
There will be very few of us that don't know someone who has been directly impacted themselves, either a family member or a friend. That's the same for me as well. We will get out as quickly as I possibly can. As I said, I need to get into Queensland and northern New South Wales, but I also need to see some of these areas on the south coast and the East Victoria areas and see that for myself.
He's right about the connections and the 6 degrees of separation. And you talk to people in your social set and they say, I'm sick of the bushfires. They don't say it in terms of the fact that there've been too much coverage. They say they've had enough of the trauma.
Yeah, part of it is often many of us, especially living in the city, we don't quite know how to help. We can give a bit of money. So when you have a sense of powerlessness and a bit of helplessness, that can make it tougher, seeing a lot of what looks very traumatic, and obviously is. And it's so visual, isn't it, all these fires. So it definitely gives a sense of helplessness and feeling like, it's like you're getting lethargic. You do start almost hitting a threshold. But at the same time, again, there's positives and negatives. I still think on one level it brings a lot of people together, right? And it brings, you know, look at it, you're showing the celebrities, Hemsworth. It gives people a real sense of perspective. So for many people, we've just had New Year's Eve. So you don't be surprised if some people pre-Christmas had a set of resolutions. But many of them will have recalibrated. Because they're like, oh, you know what? My ideas of what I thought was important in my life, forget that.
That's very true, especially being through the drama and the trauma.
Absolutely. So there's no question as a community we can come together. The most vulnerable people will be the people on the front line, especially those with pre-existing illnesses and people who might have lost people close to them. But for most of us, there'll be a lot of positives coming from this, where we recalibrate our lives, we think how we connected to each other, how do we set priorities, and giving us a real sense of purpose. This is as Australian as a lot of newly arrived immigrants have felt. I've seen quite a few people from in our communities, for example, of Muslim, ethnic
Great stuff.
communities.
I've got to go, but
sorry, man.
Tanveer Ahmed, thank you very much for that insight. Fantastic.
My pleasure.
Good on you.